Hi, I'm Dr. Trevor Murray. I've been a dentist for 29 years, and my favorite thing about Invisalign, favorite thing about dentistry is Invisalign. It is an awesome tool. It's an awesome thing. It makes a big difference in people's lives. So it changes things for the patient physically, as you can see kind of on this screen, but also it just changes them mentally. We treat a lot of TMJ with Invisalign. What we do is we treat their headaches, their migraines, just make them feel better. And so with that, we can take somebody who is maybe unable to go to work and we change their lives. Um, and the ultimate goal is to heal them and make them better from those things. And Invisalign is just a great tool to do that. I look forward to seeing patients, and seeing them and seeing the changes because a lot of times they don't believe what we say to start with until we see that in the treatment of the patient. What is Invisalign and how is it different from traditional braces? Invisalign is clear aligners, usually from anywhere from 12 to 35 aligners. It could range from about 3 months to a year and a half of treatment. And those clear liners, we take a digital scan just like on this screen, and we take it from beginning to end. So even on this screen, you can see where we started out. You can see where we finished. We can expand the arch. We can upright the teeth. We can make everything straight and perfect without having nasty braces that you have to watch what you're eating. You have to um, have trouble brushing around. It's just cleaner, easier, safer for the patient. It's kind of like driving a classic car with traditional braces. You can get there, but it's kind of rough and you don't have air conditioning maybe. With Invisalign, you get there quick, easy, smooth, just like today's, maybe electric car. Just no sounds, no movement, just get you there easy and on time. Invisalign from initial consultation to final results. What we'll do is we'll have the patient come in. We use the little wand, which is this one right here, and we use this for a 3D scan. We take the 3D scan on the patients. Once we get the 3D scan, we can go through it tooth by tooth and also just a whole bite, and we can show the patients what's going on with the teeth. Once we do that, we can do a simulation to show them where their teeth are going to go, and then we'll make a series of trays from where they are now to where they're going. Usually, like I said, it's about 9 months, and it goes really easy. Oftentimes, we also whiten at the same time because it just makes everything cleaner, nicer, and everybody likes whiter teeth. It's a pretty seamless process. We have patients from all over the world that do Invisalign. Farthest away was South Korea. So it's a nice variety and it's just some nice technology. What kind of issues can Invisalign correct? Invisalign corrects pretty much uh, crowding. Often patients that have cracked teeth, they may have had multiple cracked teeth, they may have multiple crowns, they may have multiple root canals. Usually, what we see in an educated population, those are not from lack of care, lack of brushing. Those problems are from bite issues. When what we do is we use Invisalign to correct those issues. By uprighting the teeth, putting them in the right place, um, we can correct those issues and not have future problems. It's kind of like if you had a house where the foundation wasn't square, you're going to have problems with your house. You're going to have cracked walls, cracked ceiling, maybe leaky roof. Same thing with the mouth. If you have a mouth that the teeth aren't set up squarely and upright, then you're going to have issues with cracked teeth, root canals, grinding of the teeth, maybe even headaches. And when we get those things in the right place, everything settles down and usually stop having problems. How do we make sure each aligner plan is personalized for each patient? What we do is we take a digital scan, and from that digital scan, we move each tooth individually to where it needs to go. We don't just have somebody do it. We manage everything. We make sure the teeth go to the right place. We make sure the teeth are aligned, and it's all our personal preferences, all our personal setup. So if you go to get Invisalign maybe from somebody else besides here at Allure Dental, you're going to get a totally different plan than what you get here. Pretty much anywhere across the world, our plans are way different than any other traditional Invisalign setup. The reason is because we want to upright and expand the teeth, and it's not about cosmetics. Although we want the teeth to look great, it's about form and function and getting the teeth healthy, and then making them look great is more the side effect of form and function. And so once we get the teeth in the right place, things function more correctly. What do patients say once they finish their Invisalign treatment? Usually as they go through it, they start feeling better. They sleep better, they feel better, they have less headaches, they just in general overall just feel better. A lot of times we see even their complexion change. Um, their teeth have obviously their smile gets better, their confidence increases. When they're in a crowd, they smile. When they're taking pictures, maybe family pictures, they are excited, they are happy, and just overall happier all the way around. So that is just a rewarding thing for us, is that gosh, it's just a delight to have patients that are happy, excited, and then also they just have less treatment for the future, and saves long term, which is just amazing. If someone's ready to explore Invisalign, the way to make an appointment would just be just a call, um, and come in for a free consultation. With that free consultation, we look at the teeth just individually, and we also just do a digital scan of the teeth, which is painless, easy, no commitment, and then we'll just go everything over everything in detail, and we'll show them what may need to be done, how things can be improved, and give them a timeline for that improvement, and then we just finish by making financial arrangements for them after that. It's really seamless, really easy, painless. And then we also go through each individual tooth. Maybe they have some dental problems. Maybe they haven't been to a dentist in a while. We'll evaluate the teeth and just kind of give them an overview of things so they can get an idea of what's going on.